Health. Member for Faizabad.
Thank you, Madam Speaker. To the Minister of Health, in light of a recent newspaper report that the Venezuelan national died because he was denied medical care in the public health sector, could the Minister indicate the government's policy with regard to non-nationals seeking care at public health institutions?
Thank you,
Minister
Madam Speaker. Madam Speaker, first of all, I want to offer condolences to the family of Mr. Navas. There was an article in the papers which said, "A visitor dies after being turned away from Mount Hope." And this urgent question is asking whether he was denied medical care. The factual basis is anything but that. And let me put the record straight for all concerned. The gentleman was attended to at the adult A&E on May the 11th. He was triaged and treated and sent immediately to a resuscitation room. So he began to receive treatment on presentation to the A&E. Other tests performed were bone marrow testing. He received a CT scan. He was resuscitated and sent to the neurology and hematology for further testing. The story becomes a bit muddled because he was not speaking English. And someone purporting to be his guardian / girlfriend / family friend then encouraged Mr. Navas to discharge himself against medical advice, which he did whilst being a patient of Eric Williams. So he received all the treatment, primary and secondary, according to a non-national as per protocol. His family / friend / guardian encouraged him to leave the country immediately for whatever reasons and took him to Piarco International Airport where he collapsed. He was then sent back to Eric Williams where he subsequently died. I want to put on the public record and to correct the newspaper article that this patient was not denied treatment. He received treatment at the A&E, he received primary care treatment, he received secondary care treatment. Thank you very much, Madam Speaker.
Member for Superior.
So thank you for the clarification. Would you kindly indicate your answer with respect to the second part of the said question?
The policy of the government of Trinidad and Tobago remains constant throughout past administrations. We provide primary and acute secondary care for non-nationals. That's a global practice, and we stick to our WHO conventions. In preparation for this question yesterday, because I knew the question would come, you could Google treatment of cancer patients, non-nationals, UK, treatment of cancer patients, non-nationals, USA, and you will see that those countries do not provide advanced tertiary care for chronic long-stay patients in their territories, only for their nationals if they have insurance. We adhere to international best practice that non-nationals, as opposed to other countries, near and far, can walk into any health institution and avail themselves free of charge for acute primary care and secondary care.
Member for Faizabad.
Thank you, Minister, for that response. Minister, in view of the influx of Venezuelan nationals into the country, do you anticipate that you'll have to make any additional preparations to deal with this? Because, of course, there'll be an increased demand on the health services.
Minister of Health.
Thank you. I think that's an excellent question. I think you and I, Honourable Member, when we are traveling, we always research the countries to which we are going. And these countries will have on their websites what is available free of charge and what is available for payment and whether you should have insurance or not. I think the message should go out to everyone when they are coming to a different country, as we do when we travel to North America, that you have a responsibility to make sure you are covered, especially for emergency care for situations like this. We continue to provide emergency care for non-nationals, as I have stated, for emergency and acute secondary care.